Hi, my name is Bob Taylor, and I'm your host for this segment of Our Ventura TV. I'm here today with my guest, Jay Evans, and our subject today is virtual villages. Good afternoon, Jay.
Good afternoon, Bob.
Okay, now I have lots of questions, but first of all, what is a virtual village?
Okay, let's talk about just a brief introduction to aging in Ventura County.
Okay, great.
We're projected to go from 18% seniors over 65 in 2000 to 28% in 2030.
Wow.
And the majority of our seniors live in their own home, and they would like to age in their own home.
Okay, so this is about seniors, obviously.
About seniors and about aging in place and about being able to stay in your home and your community as you age.
Now that is really important, especially in this day and age. There's so many horror stories out there, as you know, and I know, about
Correct.
Either spouse dying and seniors being alone, nobody around, aging without people being there. So what is a virtual village? How does that concept play out?
So a virtual village is a grassroots organization, a membership organization that provides a concierge, one-stop call service for services to support seniors in their home. And so if we define home as where you live, that can be a single-family home, that can be an apartment, that could be a gated community, that could be an assisted living. So wherever you call home, that's where we want to help you stay.
So the virtual village is not a confined area.
It is not a confined area. It's not a real estate development, and it is, we'll define it in terms of geographical. It's a small geographical location, but it's not a physical place.
Right, okay.
Right.
So what concierge services would be available in a virtual village?
And these services will be provided by volunteers and or vetted contractors or vendors, and they can range from assistance with helping you in the home, that's light housekeeping, handyman maintenance, light work in the yard, pet sitting, house sitting. It could also involve referrals to medical providers, healthcare providers, home health agencies, and other agencies or healthcare organizations serving seniors.
Okay, so it could be one call, and almost any of those services you're talking about, they could list you where to go or who to take care of you.
Right.
So it kind of
either arrange it or in fact arrange it. The one call concept is that the person that you contact will follow through and make the necessary arrangements, whether that's scheduling a volunteer to come to your home, whether that's scheduling a home health agency, scheduling a doctor's appointment, whatever is required. When you get off the phone, you'll get a call back confirming the arrangements.
Okay, so I could, as a senior, I could call and say, okay, here's what I need this week. I got my concierge list, and here's what I need this week, and without taking advantage of it.
Correct.
I could say, here's the things I have to have, and you would make those arrangements for me, or that concierge, which is a volunteer, of course, would be making those arrangements for me. I could, like if I had to go to the doctor on Thursday and needed somebody to take care of me on Tuesday, it would all be done under one phone call.
Yes, including transportation.
Oh, what a great concept. So you could call government agencies and everything would be under that.
Yes, the referral programs operated by governmental agencies and not-for-profits in the community. One of the core principles for a village is collaboration with existing organizations in the community.
Okay, so they have some going. Where are they active now?
Active, on the Central Coast, the longest running village, operating village, is Santa Barbara Village.
Okay.
And Conejo Valley Village is in the development phase in Thousand Oaks, and they will be operational in April 2017.
Okay, so now you've obviously done some, okay, let me start that question over again. You've done some studies on these, obviously. Why? What is your interest in all this?
My interest is trying to determine for the area of Camarillo specifically, is there an interest and a need that might be met for seniors in the Camarillo-Somas area for a village? And, you know, is that geographically defined service area the next village in Ventura County?
Okay, so, and you do that because you're on the board of Ventura County Area Agency on Aging.
Correct.
And Camarillo Council on Aging.
Correct.
Okay, now, some of those services, it seems you can only get so big. Like you said, you're going to vet some people that come and take care of me, a nurse kind of person, or a housekeeper. They can only cover so much. So would you have more than one available, or do villages only get so big?
Well, no, you would have choices.
Okay.
So even though we would develop strategic partnerships with organizations, and it is somewhat dependent upon, obviously, the size, the number of members, as the organization starts up and then grows, and as that occurs, then the types of services can also be expanded.
Oh, I see. So the bigger the village, the better the more services that can be provided, or the better concierge services can be provided.
That's correct.
Okay, now, if you know this off the top of your head, or approximate, how many does the village of Santa Barbara have? They've been there 10 years, or 6 years, or so.
I do not know, and I should have had that data for you. I know that the Conejo Valley, their projections is that their initial target membership is in the 100 to 150 range.
Okay, so they're not going to be like 4,000 or 5,000 people.
No.
Okay, so a small place like Leisure Village in Camarillo, which has 2,500 homes,
Right.
could have a number of villages, virtual villages, inside the village itself.
It could. Or it could be served by a village that not only serve Leisure Village, but other parts of Camarillo.
Right, so like we could have a concierge right inside Leisure Village possibly that could coordinate anything for that bigger group, because they already have some kind of tie-in together.
Correct.
Okay, that's a good idea, but without that, you can pick up any individuals you want, or that want to be part of this, and they can sign up.
Yes, the basic membership eligibility is that you are a senior and that you are living in the geographically defined area.
And this is done mostly with volunteers, like you were saying?
Yes.
Okay, now is there would have to be some kind of charge for membership?
Yes, the membership fees in this area are in the range of, we broke it down to $1.50 a day or $600 annually to $225 a day, which is $900 annually.
And what would that cover? If this is all done through nonprofit, what does those dollars cover? Because they'd still have the bill of somebody coming to care for them, or
Correct.
somebody coming to cut their grass.
Correct. It really covers the concierge services, that person who picks up the phone call and coordinates the services and makes arrangements for those provision of those services. The actual, and the services that are provided through volunteers.
Right.
Services provided through a home health agency, for example, obviously would be billing for their professional services to your insurance or to you privately.
Well, it's almost like any nonprofit board has to have a good one that's been around for a long time, needs an executive director, or somebody that they're paying to herd the cats and everything else. So that's what it would still be all nonprofit, but we do have to have a paid person in there.
Well, there's usually a mixture. It can be all volunteer, or it can be a mixture of volunteer and paid staff. Santa Barbara has paid staff, but they've also been in operation since 2010.
Right.
I think Thousand Oaks, Conejo Valley Village is planning on starting as a volunteer organization in an effort to help control the expenses as you start up a village.
Okay, great. Because, and I know you're not going to have any of these figures exactly, to put something together like this, and the concept, you're working on it now with other people and everything else, the two groups you're talking about, both working on it.
Right.
How many volunteers does it take, do you think, to bring this kind of thing to fruition, and not just that, to be able to keep it together?
Well, I think if you were, let's say you're trying to target having 100 members, hopefully most of them would also be volunteers.
Okay, so you can be a member and also volunteer the stuff that you can do, okay, to help the others.
It's neighbor to neighbor. It's
good concept, good saying too.
right. I mean, that's what it is about. And it's also pay forward. It's for those who can volunteer now, helping those who might not be able to volunteer, and so you're paying it forward so that when you can no longer volunteer, that you would receive volunteer services.
Right, okay, that's a great deal. And even if you can do just a little bit, and you can't do everything, that little bit you can do may be a valuable asset to your neighbor.
And that little bit could be making a phone call to one of your neighbors on a daily basis or twice a week, where another volunteer could come over and help, replace light bulbs and repair leaky faucets and
just a little handyman stuff
Exactly.
that a lot of older gentlemen out there would be so great at, that people just don't call them anymore because they're just either too slow or just can't get the job done.
Right.
Oh,
Right.
That's a great idea. All right, Jay, we've only got a couple of minutes left. So what haven't we touched on that you would like our audience to know about?
That they, as individuals and as seniors who are aging, need to be thinking about a plan for their own aging in place. And that means how they might modify their home to accommodate them, what services they might need, what their health care situation is, what their insurance is, what their financial, it's a plan. To age in place, you need a plan, and a village may be a component to that plan.
Okay, now if anybody in our audience wants more information, how do they get that?
They can go online to Camarillo Council on Aging on the website for the city of Camarillo.org, and it also has our email address, and you can go on to vc.AAA.ventura.org, which is the Ventura County Area Agency on Aging, and their website.
And I'm sure you could probably just Google virtual villages
or just village, and you can get to 60 Minutes and NPR and other papers and studies that talk about how the village can help the aging community.
So how fast has this been moving across, starting in the East Coast is where it started?
It started in the East Coast in Boston, and over the last now 15 years, there's now close to 200 villages across the country and another 200 in the development stage.
Wow, that's great. And as we get older, there's going to be, as we age gracefully, shall I
Age
say.
gracefully.
We don't get older, we age gracefully.
Or age smart.
And get wiser.
That's right.
Thank you very much for being with me today, Jay.
Thank you, Bob.
Well, thank you very much. My name is Bob Taylor. I've been your host for this segment of Our Ventura TV. I've been here today with my guest, Jay Evans. We've been talking about virtual villages. Until next time, thank you all very much.